in this video I'll talk about inappropriate touching behavior in children with autism. What is inappropriate touching behavior and what its characteristics are. Last, I'll provide strategies on how to manage the behavior. So, what is inappropriate touching behavior? Inappropriate touching behavior refers to actions that involves touching oneself or others in a way that violates personal boundaries or social norms. This behavior can be a manifestation of the child's communication or sensory challenges rather than deliberate misconduct. The inappropriate touching behavior in children with autism may look different from person to person. This can include hugging, touching, or invading someone's personal space without the other person's consent. The behavior may involve repetitive movements or touching certain body parts. While stimming is a coping mechanism for the children with autism, it may be perceived as inappropriate or socially unacceptable in certain situations. Some children with ASD may exhibit behaviors that involve touching their own or others' private parts, such as genitalia or breasts. In some cases, the inappropriate touching behavior may be sensory driven, an attempt to explore textures or gain sensory stimulation. The inappropriate touching behavior in children with autism may be a result of not understanding the social boundaries. They may not recognize or comprehend appropriate times, places, or circumstances for physical contact. So, what to do and how to manage inappropriate touching behavior in children with autism. Here are some general guidelines that may help you manage a child's inappropriate touching behavior. First, understand the cause of the behavior. As I mentioned, inappropriate touching behavior in children with ASD can stem from various factors, including sensory issues, difficulty with social boundaries, communication challenges, or a lack of understanding of appropriate behavior. It is crucial to identify causes before implementing strategies. Based on the function of the inappropriate touching behavior, you will be able to develop the intervention that is best for the child and satisfies their needs in a socially acceptable manner. For instance, if a child engages in inappropriate self-touching as a part of their development, and it stems from a sensory-seeking behavior, it is important to educate them about appropriate boundaries. For instance, you can teach the child that engaging in such behavior is acceptable in the privacy of their own room with the door closed. Second, social skill training. Use visual supports, social stories, and role-playing. You can help the child understand appropriate behavior in different social situations. This can include teaching about personal space, private areas, and appropriate touching. For example, you can use an activity with the child to teach the child the concept of personal space. Place 2 hula hoops on the floor, one small and one large. The smaller hoop will represent the personal space for the child, and the larger hoop will represent the personal space for the adult. To have a visual understanding of personal space, the child will stay in the smaller hoop and the adult will stay in the larger hoop. The adult can show the child how close the child can get to another person and when it is the time to ask the other person for permission to step in their personal space. Third strategy is to teach communication. Encourage the child to express their needs, wants, and emotions in socially acceptable ways. Improve their communication skills through speech therapy, augmentative and alternative communication system, or sign language. When children with ASD can effectively communicate their needs, they are less likely to use inappropriate touching. For example, if the child uses picture communication, then you can use images showing people giving high fives, handshakes, or friendly hugs to demonstrate appropriate touching. Also, here you can design a red and a green zone. The red zone represents actions that are not appropriate, such as touching someone without their consent. The green zone represents positive and acceptable behaviors. Fourth, sensory regulation. Some children with ASD may engage in inappropriate touching due to sensory seeking or sensory processing difficulties. Provide appropriate sensory input and create a sensory friendly environment to meet their needs. For example, here you will develop a choice board with a variety of sensory activities. You can use the choice board throughout the day and offer the child multiple opportunities to engage in sensory activities that will compensate for their sensory needs and decrease the chances of engaging in inappropriate touching behavior. Fifth, use social stories. Create and utilize social stories to help children understand appropriate boundaries and behaviors. These tools provide visual cues and help children with ASD navigate social situations more effectively. For example, you can create a social story where you will describe what a personal space looks like, what to do if the child wants to step in another person's personal space, and when, in what environments we would be aware of another person's personal space. Sixth and last, redirect and reinforce appropriate behavior. Use positive reinforcement techniques to reward and reinforce appropriate behavior. Redirect a child's inappropriate touching behavior to a sensory activity or to functional communication. Praise and acknowledge a child when they demonstrate appropriate social skills or use alternative behaviors instead of inappropriate touching. For example, if the child uses a picture of hug instead of just walking up to a person and unexpectedly hugging them, you will praise the functional communication through pictures and offer the child the requested hug. It is crucial to approach the behavior of inappropriate touching with empathy and seek guidance from professionals experienced in working with children with ASD. Applied behavior analysis therapy, occupational therapy, and social skill training can be helpful in addressing and managing inappropriate touching behavior in children with ASD, while also focusing on teaching appropriate social skills and personal boundaries. I hope this video helped you understand what inappropriate touching behavior is, its main characteristics, and how to manage it. If you have any questions, make sure you type them in the comments below, and I will do my best to get back to you. Thank you for watching. I'll see you in the next video.